cultivating this in the young people would be a great idea, Here we have an example of this young man. Marguerite Gooden, I don't know if you know her from the New Directions program. She also has this young person that she had worked with and is always singing his praises. The more
there's
those
another
we
one
have, the
over
better.
There's another one in DHS, and Lynn, you may know him. He works for the Community Services Board. He was on the Teen Network Board, I think, about the same time. He lives in Arlington, has a family, or what am I? I'll think of his name. I mean, I see him all the time because he goes to the playground where I take my grandchildren. But he has a great position in the county. It starts with an R, John. What am I? Not Route.
Rubel.
Rubel. Yeah. Oh, yeah.
Rubel was a Teen Network Board.
Oh, is that right? I never knew that.
I knew him when we knew him when he was a freshman in high school.
Oh, really?
Yeah.
Oh,
Yeah.
wow.
Yeah,
No, Rubel is doing very well in the county. He's got a
know.
very high level position. Yeah.
I know.
Well,
I'm so happy.
I did not know that. I didn't know that.
But had an interesting family history.
Yeah.
Well, we got Tito, Robert Vilches.
Tito, yeah. Tito's local.
So in any case.
Well, that's a great idea.
Many teachers who are from Arlington, who grew up in Arlington. A ton of Arlington teachers were students here.
Mm-hmm.
My daughter's principal at HB, Sally's classmate.
Oh,
Is that right? Oh, wow.
She's younger than me, but we were in French.
Oh, not classmate. Oh, okay.
My son hopefully will be getting a job with Arlington Public Schools for the fall.
Who is?
My son David, our
good.
youngest.
Oh,
Great.
He interviewed with Alexandria. I said, don't go to Alexandria. They stink. It's
Oh my
Arlington
gosh.
or nothing.
Arlington rules, Alexandria drools.
Yeah.
I love that. Let's put
all right,
that on
last
some
thing
swags and pass them around.
I know. Last thing I wanted to talk about today, if we get to it, is the budget. The process is chugging along. I've mentioned at the meeting, and I can do the same thing again if anybody's interested in following the budgeting processes, either county or schools. And we can do a call for budget requests again. And I think what's going to end up happening is I'll probably draft a letter and send it to this small group and, anybody else we think would have some good input. The cry for help that I heard loud and clear on the budget so far from our big group is for the schools to have additional counselors and psychologists. Am I right?
But you can't get them.
no.
Yeah,
Right.
Yeah.
Well, psychs and social workers, they
Right.
need more psychs and social workers.
Social
They're-
workers.
Yeah. And I don't know if you know this, but in the budget, they're losing. They're taking away.
I
It's
did
proposed that
take
they
a-
lose some psychologists.
Oh, well, then that would be a great item for us. I actually didn't see that, Judy. Is that in all I saw was the outline, and I saw that it's going to be a tight fiscal year because their extra COVID money is running out.
Yeah. I'll send you the portion where it describes it and all. And really, I don't know, I've been talking to Wendy Correa, who's head of all the psychs and social workers. She happens to be a neighbor, and so she can just walk down here. And yes, they really need more psychs and social workers, but apparently with the way the budget is being done this year, the focus is on teaching and learning, or whatever that is. And next year the focus is going to be more on mental health. The budget is 400 and some pages long, and I have not read the whole thing. But she said they want more, they need more psychs and social workers, but if nothing else, they have to hold on to the ones that they have.
Yeah.
And
How many are they losing? How many
I
positions
think
are they
it
losing?
was maybe 4
Wow.
or something. I don't know, but that would make a big difference because they have some
Yeah.
schools that just have a half-time person.
Oh my gosh, and the cries for help that we've been hearing, Judy, on your youth mental
Exactly.
health and wellness meeting. I
Yeah.
mean, that was so stark.
This goes in the opposite direction of what all the indicators
Opposite.
are. Yeah.
You know
Totally
what I-
opposite direction.
What I understand from the school budget, and I could be, not totally informed, is that, one of the things they're able to do is cut back because the student population projections, I don't know if it's the actual population or the
Yes.
growth is not expanding as quickly as they anticipated. And it could be that they're cutting these positions because they think they're not going to be, required if you think about the ratios and everything. And that's the way to save money. We don't, we've got fewer students or slower growth. We don't need to keep all these positions, but the net effect of keeping those would be to have a lower ratio of students to psychologists. So really, that is a good
That
thing to
makes
fight
sense.
for.
And then they pick our neighboring jurisdictions and say, look, our ratio is just the same as their ratio. So we must be okay. And it's just not adequate.
Right, we know
I
that's not the
mean,
case. We know that's not the case.
Well, if you
when
go
the
into the
school
proposed
population-
budget,
When the population changes, you can reduce the number of teachers because you don't need as many teachers. But you can't reduce the number of principals unless you close the school. And you can't really reduce the number of social workers, psychologists, whatever it might be, because you need those in every school. And so the number of schools doesn't change just because the number of kids do. And so I think it's a very poor argument to
that's a really good
scale-
point. Yeah, because it's number of hours per school, and so if you cut the staff, you'll just be having even less of a part-time presence in each school. Unless
Yeah.
you're cutting schools. That's a really good point, John. Don't give me your stats as a shield, as a screen. What were you going to say, Judy?
no, I was just, let's see. What was it? They,
About the budget.
so they're going to be, oh, I know, if you go in and look at the first or second document online, it's sort of the bare bones of, what you're going to find. It's his superintendent's presentation and stuff. And you'll be amazed at the number of new positions that they're proposing, not for student services, student wellness, those kinds of things. They do mention social emotional learning sometimes, but you can see a lot of new positions being new. I mean, it sounds like they're new. It's not like they're replacing. They sound like new positions.
What's the new work? What's the new work that they're trying to do with the new positions? What
Well,
area?
I think that this is, like I said, I had heard that they're really looking at teaching and learning, and what are we calling, not just teaching and learning, but there's another piece of this, of the APS framework or whatever, that is also sort of like teaching and learning, and they're revving those up. Of course, this is all a proposed budget, but Bridget has put in all of those things, Bridget Loft, and I think she knew what was coming in terms of the focus that the superintendent and all the whoever's over it there want to go. And I think, Wendy wants to do more than just hold on to her psychs and social workers. She'd like more, but it's looking pretty grim in terms of just holding on to what she has. And one thing I think is a problem for getting, I was thinking about this a lot this week, community buy-in or community, I don't know, positive feelings around psychs and social workers, because they don't understand really what they do. And the truth of the matter is, a lot of the psychs' time is spent doing special ed evaluations. I mean, that's maybe half of their job, is doing all that work. And people, they don't have a visible position like a counselor or like teachers. So it's really hard to get people to rally around. We need more psychs and social workers.
Judy, you are a neighbor of Wendy. And so maybe as a neighbor, you could ask her for some arguments that someone might use to support what the administrator, Wendy, would like to see. I mean, 'cause I mean, I know from the kids, and what they say is they have trouble accessing the right kind of mental health support. And I know that they're having trouble hiring people that are counselors, mental health, whatever it would be. But I can't write the argument quite the same
Yeah.
way someone that's in the trenches could. So
Right.
if you could come up with something that Megan can put in a letter,
Yeah.
that would be really helpful.
Wendy's already
Just-
written something, but it was more for people to send to school board members. And she wanted opinions on it, so she sent it to different people. And so she gave it to me, and that's where I was looking at it thinking, wow, people you want to have them send it aren't going to understand. They don't even know who the psychs and social workers are at school. We've got to spell out better, what they do. Because I think the expectation is any child, if they have a mental health issue, will go see a psychologist. When in reality, good share of that psychologist's time is spent on special ed evaluations and meetings and all that.
Well, at a minimum,
they-
share that letter with us.
I will.
Yeah.
Yeah, she just brought it over yesterday, so
Right.
I'll get it to you.
In my experience in terms of managing the DHS counseling position in Carlin Spring for a number of years was that there is in their continuum of care, mental health, behavioral health care, there is direct service that they provide. They have an identified counselor who has school-based counseling sessions, and then also groups, sort of socialization or prevention groups that they run ongoing. It's just that the resources was, and I think part of us being at Carlin Spring was we really, supplement what they were doing, not replacing, but really supplement the direct service that was, sorely needed at Carlin Spring, and that continues on. And I know that there are some counselors or school psychologists that straddle a number of schools. They just come to Carlin Spring, for example, 2 days, and they're at other places because we share the spaces with them.
Right.
But I think as we're talking about it, it may not be a bad idea to have a full presentation by Kristen Devaney on what is the mental health component at APS. What exactly do they provide, in terms of service? How much of it is direct? What does it look like? What is the distribution of resource like among the schools, and how do they assess whether they're meeting the mental health needs of the schools? Because I think right now, from what we're hearing, especially Judy, if your impression is that much of their time is taken up by sitting and processing IEP meetings, well, there's a bunch of other needs in there that's not being addressed outside of that. So I think to get the correct information, the true information from them, and it gives us like a good map of what exactly they're covering, what else we can support.
I think
And
Wendy
not
should
to
come to
mention-
that meeting too. Yeah.
Yeah.
I was
yeah.
going to say, not to mention that'll kind of fire up our members as well.
Right.
I think to have that in front of the big group.
Yeah. And I don't
Um,
know, have they done that recently for partnership? Have they come and spoke? Because I know they came and spoke to our BHB folks, because they have a team. They have a smaller team of mental health assessors that when there are issues that school counselors are identifying, then this team kind of roams around and do a more thorough assessment of what mental health needs are, and if they're impacting that school domain for the individual. And this is different from special education assessment. It's more of like a mental health team.
Yeah.
So we want to hear more about that.
Yeah, and Wendy would know that. And I don't want to give
Yeah.
you the impression that these psychs and social workers are there and they're doing things they're not supposed to do. Their time, I mean, they're probably
yeah.
being paid out
Yeah.
of federal funds
Right.
for, I mean, just because they're there full time doesn't mean they have
Yeah.
full time
Yeah.
access.
No, I mean there is a lot of truth to what you said, Judy, because in at Carlin Spring alone, I know that the school psychologist one year who was assigned there knew she was rolling in, and that was the issue, was that she was so accustomed to just doing the screenings for special ed, that she was not able to switch gear to do the in-office direct service that, our staff Sandra was doing. And that affected our capacity, during that moment when we had, increase in crisis. So yes, so that's a reality. And I think that when push comes to shove, I think they do prioritize that process of screening of special education needs, because the funding for those positions are tied to that function, I think.
Yeah.
Yeah.
Rick, I'm mindful you were going to have to leave early, and we have not talked about the navigator piece, but I am hearing, it might be time well spent at our March meeting to really focus on some budget issues, which don't necessarily mean it's not related to the other work we've been doing.
Yeah.
Should we, Rick, do you want to give your impressions? Do you have a minute or two we can steal from your deadline to hear your impressions back from the last meeting? What's that?
I'm sorry, I'm getting a message from your little thing. If you don't mind, give me 1 second so I can respond to this. I have these 2 overlapping meetings where warehouse people are waiting for me to enter. And I have to remind them I said I'm coming 6:30. So give me 1 second. I'm so sorry.
What do others think about focusing on budget? Because I think this is a big issue. And Judy, it just, I was so, really kind of taken aback by the situation that woman at who presented to Youth Mental Health and Wellness just presented as her day-to-day life, trying to manage the challenges.
I know. And I've been asking other people about that, and I haven't found yet other schools where that's happening. It's definitely not happening at my grandchild's school. It's not happening at the school for my daughter. Well, it's not happening at Barcroft.
They feel like it's better. Things are better there.
Yeah, for whatever reason. And we don't know, because I don't know the counselor she was from Claremont. And I did call her afterwards, and I did send her a bunch of material, things that we had, and I haven't heard back from her. But the impression I've got is, wow, that's pretty extreme. No, I don't see anything like that at my school, but that doesn't mean that's not the case. So yeah, it was disturbing.
She was very overwhelmed.
Yes, very overwhelmed. And we are looking for, Kristen is looking for middle school counselors and for us. And I don't know, I'm trying to think if it was psychs and social workers too. Might have been just, it was all about mental health.
Yeah.
So I don't know who Kristen is finding. I haven't talked with her about that. I just sent her an email, and then I need to follow up. But really, Wendy would be the one to also to help us with her staff if we wanted psychs to come. I don't know if I want psychs that day or not, but can't ask for too much time, because their time is, ask them to come to the partnership meeting, ask them to come to the mental health and wellness meeting. They have so much work.
Yeah. I think between Wendy and Kristen, definitely they can coordinate, what that presentation looks like, or who would do that, who would give that good picture for us.
Yeah.
Oh, okay, I'm back.
All right.
So I think so we're talking about this idea of community navigators, specifically at I guess my interest, of course, is in sort of adolescence. It seems like, so as we're going through this process, we are sort of learning about different resources and existing things that are out there. One of the, one of the things that me and I were talking about this morning is the idea of getting Grace involved to pull out some data to see, what are the needs that we're looking at? What are the things that the data is explaining as, what the needs are that a community navigator would answer. And community navigator, meaning having somebody in the community, from the community, sort of being a point person, a resource for that people could go to. So we look at the example of the Carlin Springs Community School and the Kim Duran's group of people who, this is exactly kind of what they're doing. We have people like that in these AHC and Arlington, the other Arlington Affordable Housing Company, AHAP, what is it called?
APAC, APAC,
APAC.
APAC,
APAH.
APA,
So,
APA.
APA, there we go. That, are already filling these roles. So, it's not a question of reinventing the wheel. It's sort of deciding whether there are places to go other than what's already established or populations with unmet needs. And that's where maybe we get Grace to come in and help us better understand what these unmet needs are, and perhaps even understand, if in places that this is working, what are the factors that make it useful. So the more I did, the more I realized that there are lots of resources out there. We have, Carla Turcios, you probably know, Lynn, was sent out an email recently about all these things going on where they're setting up, let me see if I can find that email. Sort of little groups that are doing activities. Oh, I wish I had a better, I should have written this all down before I came home. I left all my notes at the office. But, she is doing something that is reaching out to the population that I'm concerned about. The population of people who are in the struggling, but not in the worst case.
Oh, I think you sent that to me too, Rick, and I'm just on too many devices to pull it up right now. Maybe
Yeah.
if that's one of the emails you sent. Yeah, it was sort of about one of the things that's going on.
So,
And I did ask to see if Grace, I followed up after your suggestion to see if Grace was available to join us as we brainstorm tonight, and it was too short notice for her to make a childcare
of
plan.
course,
So
yeah. So let me see. Carla Turcios' thing is AHC, Project Discovery, 7 properties. For $50, the kids get weekly one-on-one tutoring and mentoring sessions, college visits, community service opportunities, workshops and goal setting, scholarship opportunities, career exploration. That sounds terrific. Of course, I just got this, last week and haven't had a chance to follow up with her. There's also this model of tutoring and mentoring, which Megan shared with me. Well, and it's a similar kind of thing. The question is, there's a real concern I have about kids who are, they have the drop off at middle school. Parents are really involved in PTA. They go to 6th grade. They're still involved, but 7th and 8th grade, things sort of drop off. And are we picking up the slack? Are we helping these? Do we have things for these kids? I don't know. I'm not sure. I am not presenting this in an organized way, but in my own way of sort of going all over the place.
Yeah, AHC has a very robust volunteering program where they do tutoring after school programming, and they have more than, I think it was like more than 250 volunteers. And for the past 3 months, prevention has been working pretty closely with AHC. They came to us with, can you give us a presentation on mental health on kids? And then we had a big consultation, and we kind of assess that they need more than just that one, training. So we strategize a series of trainings for volunteers and staff that starts with a mental health 101, which is a simplified version of mental health first aid, seeing signs and symptoms. And then we also, the next step was we did an ACEs presentation. Leo did that for these individuals, and really a lot of these individuals are saying, the volunteers are saying, I don't understand where they're coming from, right? So if they're recently arrived immigrants or from a different cultural perspective, they want to be more, the request was cultural competence training. And we said, we'll do better than that in terms of learning more about the role of trauma in many of these children's lives, how to mitigate the impact of trauma, and increasing resiliency, especially through your interaction with them. So we had ACEs, general ACEs, dive deeper into, okay, now that you know those things, how can you practice these principles in your interaction? So 2 sessions there. And then the next session, we're going to have more of a communication thing that Michael Swisher is going to look, to do training on specific, like lean in, love, listen kind of communication with these individuals. So, go ahead, Rick.
Interrupting with, so this, any organization gets 250 volunteers to do anything
Right,
is an amazing feat. It is an amazing,
exactly,
wonderful
right.
feat. Are these mostly elementary school and, younger middle school? Or are these older?
Yeah, I think it's middle
well?
school and down, not older. I think mostly middle school, down to elementary. And you're right, is that we were looking at, kind of gatekeeper kind of training, folks who are already in the community are connecting, have access, have paved pathways to connect with these communities. And then, kind of riding behind their drafts and also identifying what their needs are and how can we supplement. And I think
Mhm.
that's sort of where I remember is some elements of our navigator, conversation was, sort of like Kim Durant's group, so that's what the COP program is doing. And, where can we join, forces? Where can we, if they help us identify growth areas, that's where we need to go, to just not reinvent the wheel. And I think that, and I think that we have these various groups in the community beyond COP, beyond, AHC, that is in Arlington. And maybe this is the process in the short term to identify where these groups are. And then we can have, individual, kind of collaborative relationships, or even start more of a kind of sort of like a coalition sitting at one table and have a, World Cafe kind of style conversation, which, Kim did in the past, to really have that larger, because there's so much intersectionality with these groups and the work that you do and the population. So I can't imagine us running around individually working in silos with the various groups, but how do we, kind of gather together, and have that collaborative, co-creating approach to something that is very specific. And if we want to tie it down to how to, build resiliency, how to, close the gap on that we're seeing in terms of opportunities.
Another thought too, Lynn, is how do we, I could imagine having Connie going in there and doing a training on community activism and, self-determination and parental empowerment, which I know you guys are already working on with Michael Swisher, but we're not coming in and rescuing them, but we're helping them develop their own resources. Are the volunteers that you were working with, my experience with volunteers, I have long years of volunteers, but not tons of volunteers, but it's always usually very well-intentioned, highly educated white women who really want to make a difference. And they do make a difference. I don't want to denigrate that, but they're not people from the community, and they're not, they don't have that same, their ability to relate and interact can only go so far. Is that the case with the volunteers at these sites?
That's what my sense was. Yeah. And I mean, if you look at, in terms of privilege, I mean, I think it's a privilege that you have the resources and time to volunteer. I think many of our historically marginalized communities are in phases in their lives that they do not have that luxury. Even if they want to, they do not have the luxury to spend their time in that way. So you're right. And I think the direct request for cultural competence comes from that, is that, my heart is in a good place. I want to do this work, and this is what I know of what study habits is, for example. This is what I know about this and that, but it's not jiving with the person I'm sitting in front of, right? Why is that? And I think they have some kind of cultural miscommunications perhaps, and they wanted to kind of, and I think that was a good request, but then we kind of broaden it up. And of course, in our trainings, we talk about cultural competence, cultural humility and all that. But beyond that, it's loaded with ACEs principles and the idea of understanding, appreciating a person's trauma context, and how do you weave that into your work was important.
Yeah.
Well, and it just reminds us of the need for funding. I mean, if the
Yeah.
people who have the time and resources to volunteer are all coming from one demographic, then that's why we need to fund a position, because, instead of people who can afford the extra time, let's find somebody who,
Yeah,
could
exactly.
be
Exactly.
paid
Yeah.
to do this work, who comes from
Exactly.
it.
Right.
Hmm.
And I think that's part of the idea that we've talked about of a community ambassador or block ambassador is part of equity, is to really pay these, individuals who are volunteering their time. If you want to have the in community person, that you need to have that mechanism to, that's part of equity. So.
I do see a
Well-
lot about, I don't know if the rest of you do, about Buckingham. And I mean, they have a bunch of moms, one mom and especially who is sort of the leader of the group, but she collects items and people volunteer to help her distribute them and all. But they all rally around her. She happens, I think she's a school bus driver or a bus attendant. Mariflor, have you heard of Mariflor? John, have you heard of her? No. Oh, I'll have to get some information. Because it's pretty interesting what she's been able to do just in a grassroots way and get all of Arlington. There are people all of Arlington who are donating so much stuff.
Is
to
this
her.
Buckingham, the neighborhood?
Mm-hmm.
I have a friend who tells me about her.
Yes.
Yes,
Let's
and
go
she just
visit her.
gives her time. So here's a person we already could
Yeah.
hire.
Well, you could hire, we could pick her
Who's doing
brain
the
too.
work.
Scale up, and
We could
scale
pick
up.
her
How do
brain
you replicate that in other communities?
Yes.
That's
Is
a
that
been
great
super
connected to
effective.
the youth brigade, the Buckingham Youth Brigade? Are they connected as well?
I don't know if she's connected
This
to
is
them.
like through Free Cycle or something that my friend found out about it, I think, and she's in
Oh.
that neighborhood.
Yeah,
And it
there's
just became like a
Yeah.
person, like if it's the same person, I think she's willing to come get your stuff to
That's right.
match it up, your donations. She just puts all her time and energy into.
She does, because she doesn't want to see her neighbors' kids not have a warm jacket. She doesn't want to see them hungry. She's
Do
amazing.
you know her name, Judy?
I think it's Mariflor. I'll look it up.
Yeah. Michael
Um,
Swisher probably know.
Yeah, I had a stroller and I took it, it was easy. I called her, you need it? Yes. Come this time, gone. It's just, but she does monthly or whatever collections, and her house got so full of stuff that she had to, I think maybe the county or someone helped her rent
Well,
a storage thing.
Well, I think one of the points that Lynn I was making is the idea of developing sort of a network or sort of threading things together. So it's sort of a bigger kind of thing, because it's not, of course, Arlington is not a community without resources. And we
Right.
definitely have examples of things that are working, and that, if they had more money, if we got a grant, I'm sure there's probably some sort of a grant out there that would, that recognizes this kind of thing that we could apply for and use that to pay these people.
Yeah.
I don't know if I
anyway.
said, if I brought back to this group, but I caught up with somebody I know who was on the, all I think of is reshaping prosecution, but basically the Arlington initiative from a couple of years ago that did a report on, what is it, Rick?
Restorative justice.
Restoration.
Yes, thank you. Restorative justice.
Yeah, restorative
Yeah,
justice.
and their dynamic task force group, they appointed her to be the grants person,
Yeah.
because she's going to get the job done, even though she doesn't have a background in applying for money. But I mean, that task force has just kept going with, to sort of to the fundraising stage, and with community volunteers doing that level. Which I guess brings me back to, in our last 6 minutes, the agenda for the March meeting, and what conversations we want to bring up or guests we want to invite for next time. And I'm hearing a lot of great ideas. I think budget is a little bit time sensitive. If
think
there are
budget
steps that
is
we could take.
important. Yeah, because it'll take some time after we listen to what people have to say. And I don't know who feels comfortable coming and sharing things in terms of staff. I assume Wendy would. And I think you would have to have, Kristen's still kind of new at her position.
Mhm.
And I know, you know, she has said to me, she has not been able to get out into schools and do stuff. She's, you know, pretty much limited with time-wise to
Yeah.
being in the office. But that doesn't mean she doesn't know what her, well, and the counselor thing is a weird thing too, because
Yeah.
principals have so much to say about what they do.
Maybe we can
but-
ask all three, like Laura, Wendy and Kristen. This is, and they can work it out, and who may be able to do that for us.
What is the
But one thing I
purpose?
want to avoid
have
is
them
Laura
come.
saying I've got it, because
Yeah.
I would love to hear from voices we don't hear from.
I would
Yeah.
rather ask for the psych and the person who's responsible for the psychs and the
yeah.
one who's responsible, and the social workers and the counselors.
Right.
Because this is not going to be her thing, I don't think, to be able to, and I think she's usually kind of worried about pleasing those who she works for.
Right. Yeah, that's a good point. But although
Puts her in
if
an
the
awkward
money
position.
is moving towards curriculum and instruction, that's under her, right? Do we want to hear more about that, or what that is?
Oh,
Is that under
under
her?
Laura?
Laura? No?
No, she's still
Student
counseling.
services.
She's
Okay.
student services.
Right.
She's still student services.
Yeah,
Judy
you're
was
right.
talking about Bridget Loft and what the Department of Teaching and Learning has called it
Yeah.
now. I thought, I don't know. It's,
Yeah.
I was just trying to, new APS.
If we have someone come, it's important, I think, for it to be purposeful and to move things forward, or to get ideas for what to advocate for example, or things that we want to express our displeasure or support of.
I think the goal is to find out, how we can best push back very specifically on cuts to the psychs and social workers, whether that's a need that they see, and how we can shape our letter. So
Yeah.
it's
Mhm.
it's pretty specific.
About advocacy,
You
yeah.
What's the impact going to be if these cuts are go through this year?
Mhm.
Because out of that conversation, I think we can put a letter together. Is
Yeah.
that what you
Maybe
mean,
we
Randy?
can send out questions too, so that keep them focused on our concerns and not give a
Well,
huge presentation.
It goes along with all the work we've done on, mental health and wellness.
Yeah.
Yeah.
The youth mental health and wellness
Mhm.
that the partnership has done, and what the needs are out there.
Mhm.
Yeah, and when we brought up budget before, I mean, I'm one to listen to the squeaky wheel. Our volunteers sort of didn't say a lot. I don't think when we talked about budget before, but that's something I heard loud and clear. So
Yeah.
if folks have if they have county budget items that are up for cuts, that they want to flag, that's great.
Don't know.
I don't think we have any.
But I didn't hear any yet.
Yeah,
Yeah.
yeah.
So
I would guess most of the partnership members won't look at the budget in detail. So getting an overview of the major additions and cuts for 5 or 10 minutes might get a conversation started. I mean, I've listened to this conversation, so I can say something, and Judy referred me to a section of the budget to look at. But otherwise, I don't usually go through detail. I mean, and I don't
for me,
think.
that was really helpful.
There's a fair
Linda,
number of
I think,
members.
highlighted.
Well, members, a lot of them haven't even come to meetings before, so they wouldn't know to do homework.
All right.
So someone to say, here's, not even to defend it, but just a flat, here's the budget. Here's what's happened. Here are the big moves, one way or the other. And then people can talk about, well, what's the rationale? And maybe we'll argue that out. And the rationale for cutting mental health type activities might be thinner than the rationale for adding some new group for instruction. Kids are
Right.
behind in instruction too. So
I don't think it's too much to ask partnership members to look at not the whole budget document, but that initial, they've got things, some fairly brief sorts of section, pieces there that I have to go back and look because I'm just getting started in it. But it wouldn't be that bad, John.
I think, well, there's a difference between not asking too much, no, it isn't, and whether or not people will take the time to do it.
Well, there's that. And then Judy, I remember last time when I feel like it was Linda and you who raised, maybe it was 2 years ago, I did the budget letter. And I couldn't find what the cuts. So those things, the overview is all peaches and cream, as you know, generally. And the rubber hits the road if you know where to look, which is like, not always as easy to find.
Right.
So that's, and John, I hear, it'd be great if we have an overview that we can present as part of the meeting.
I agree with that. I wouldn't know how to find out.
Are you willing to provide some of those bullets, or do you think we have resources that we can put into that before the meeting?
I certainly can't because I'm not that familiar with that. I haven't gone through the budget.
Yeah, I mean, it'd be homework for any of us, I think, probably. Thank you, Rick.
Thanks, Rick.
Okay, bye, Rick.
Unless there's somebody who's already one of our liaisons who might be reviewing it as part of their day job, who could let us know what they know.
That would be school, right? It would be.
We're talking about the school budget.
Janetta?
Yeah, I don't know.
Well,
And even beyond our members, they're going to be people on ACTL who are looking at this very carefully.
Yeah.
And they're going to be concerned about some of the same things we'd be concerned about. There may be somebody there. That's all I'm thinking.
What's ACTL again?
It used to be ACI. It's where the advisory committees, student services falls under ACTL.
Oh,
So,
okay.
and Bridget is the sort of the head of ACTL, the staff person. But there are all these committees. There's math, there's science, there's, student services, there's all these committees. And they're all looking at the budget also. So maybe, I don't know who, but maybe we could find someone there.
Maybe we tap into our school and board liaisons and say, hey, you're our liaison. Who would you suggest can come talk to us?
That's a
I mean,
good idea.
maybe our liaisons should come tell us, our board member and our school board member can give us their song and dance.
I'll ask Dulce if anybody can do such a presentation. She
That's a
does
good idea.
communications, so I can do that.
That's a good idea. Yeah.
Yeah. And I guess, to highlight, we're really interested in youth mental health and wellness, what cuts are going to impact our youth for good or for bad.
Sure.
Thank you. Okay. I don't want to lose the thread of the navigator, but we've had a number of sort of, loose conversations about it. I'm not sure how much I have to say that would be structured to move that ball forward at this point or right now. Go ahead, John.
Agenda. Yeah.
Mhm.
Well, I think the last meeting, we heard how effective those who exist doing navigation can be. So Kim's group and Carol are working with parents. We're trying to argue for more, but I don't know that we have the evidence for where they would be, how they would be. Maybe this lady in Buckingham would be the example of why more would be valuable. But I don't think we have the data on that yet.
Yeah.
We're still struggling to find her name.
Right.
So,
I found her on my phone, so I'll send it to you. She's in,
Awesome.
she's on Facebook all the time. So
Yeah,
Fine.
my
Maybe
phone
just
number
a
is Mary
quick
Flor
a quick
Ventura.
mentioning of what John said, just a quick mentioning of what John said is enough in terms of touching on that navigator in the large meeting, but not to go into more substantial than that. And I think we can loop back to this group with contacting this woman and whether she's coming to present at the next meeting. And then that's more, more information for us to proceed forward of, okay, are there other groups like that, or how do we help and supplement her efforts in her community?
It'd be really nice to find someone in Green Valley doing something, or discover there is no one in Green Valley doing. I mean, Bridges to Independence is the only group I know actively working there as a nonprofit,
Yeah,
and that's pretty recent since they
right.
merged.
All right, and then how about, I'm very mindful that we haven't yet invited Kirsten to speak about Project Peace.
Candace, you mean? Candace?
Candace.
Project
Okay,
Peace. Candace
shoot,
Lopez.
sorry. Okay, Candace Lopez. Sorry, I had
Yes.
that wrong. I thought it was Kirsten who had asked
Candace
us,
Lopez.
or
yeah.
Kristen. Okay.
Candace Lopez. Yep, she's the coordinator of Project Peace. Yes. So that could fit in for the next month's meeting of this woman in what is the community again? I'm sorry.
Buckingham?
Oh,
Yes, it's
Buckingham.
Buckingham. Yeah, Buckingham, and then Project Peace. Those are two nice chunks for a presentation.
So you think we have enough to just talk budget for our March meeting and skip Project Peace this time?
I do. I mean, because
Yeah,
I think if
yeah.
you have two people, person or two present, and then you have questions and discussion, you're gonna have to cover quite a bit,
Yeah.
because there's not gonna be that much time after that
Right.
to kind of get things together.
Right.
Okay,
And if there's a
we
little bit of
don't
time,
get presenters, or we're pretty optimistic that we're going to find some people.
yeah, I think so.
I assume we'll get somebody to talk from the schools about the existing program for counseling and mental health.
Right.
Is they're our friends directly. Whether we can get somebody to talk about the budget, I don't know.
Yeah.
That's gonna be a
That's
harder
tougher.
one.
That's a tougher one. Right.
But I'll check the people I know to see. And
So part of the existing services, mental health services too, maybe we can tag on a little bit more of an elaboration on the social emotional learning survey, because we got some information from Grace, but she didn't have the full picture. She gave us a little bit of it, but if we have a school person to speak more about that, that could
Is
also
that,
be helpful.
Lynn, with a budget impact? Because it sounds like they're full steam ahead. Are you saying it might be?
No, if we are done with the budget talk, and if you need a filler, and since school is already up, with the mic speaking, and if they are also reporting on what are they providing, what is their continual care with mental health services, then we can also ask them to elaborate on the social emotional screening that is happening, because I don't think we have the full picture and all the details on that.
it's a good idea. Do we have any sense of when Grace is going to have the data from the last survey? I mean, whenever she comes up with it, that's going
Yeah.
to take a chunk of some meeting.
Yeah, I don't think for
Not open
until
yet.
it's not
Your
done.
Voice Matters isn't even
Yeah.
open yet. It's like
No,
No,
yeah,
but
your voice matters.
we
is
never got
in
the
a couple
data.
months' time. Yeah.
Aren't we late on the data from last time? I feel like we've missed a whole cycle.
it was
No.
only
No.
every
No.
2 years.
So we're on time with this data that's still behind the scene that's happening now. I don't think
So-
we're going to see it until May or June, but this is not too early to kind of gather together the data group. To once we can see it, how do we crunch the data our way, and how do we look at the spikes and produce that report that we typically do to go out and present to our community members, right?
Well,
That
how
was
about the
part of-
Virginia, the youth risk behavior survey? I thought there was data that was in that Grace kept talking about.
She was
That I've never
expecting it in
seen.
January at one point, and then last time I
Yes,
heard.
this
Yeah.
isn't the new Your Voice Matters,
No,
Lynn,
that
because
one
that one I
hasn't.
know, but there was data that I thought was,
It's
has been
not,
working
yeah,
on
she's
this
there-
whole time.
There's nothing that's out and she's holding on to.
What's the timing for youth risk behavior survey?
It should be the alternating year to Your Voice Matter.
Right.
I think they're doing it.
What
this
happened to that?
spring.
They're doing it the same time?
I think they're doing it this April.
Right. Yeah, yeah. Yes,
The
so
the school one, the county, the state one is every year now, I
right.
understand, and your Voice Matters is probably every other year.
I feel like the last time we did a data presentation was pre-COVID. It's been 2 years.
Yeah.
So we must have missed some surveys in there. Because it was pre-COVID when people were
Right.
sharing that data
Right,
around.
the 2019 data came out, but that was collected right pre-COVID, so that was collected, I think, fall of
That was the
maybe
fall of
yeah,
19, right?
right, fall of 19.
Which
fall of
one was
19,
that? Youth risk behavior or the
yeah,
year
youth
versus
risk
now?
behavior. So that was the
Okay.
fall of 19, and you know, really COVID hit around March of 20, right? So that was collected before the big impact.
And we didn't do anything substantial during COVID last
No.
couple of years.
No
No,
surveys.
no,
No.
We don't have any data from
Well,
those.
I was pushing really hard to do even a non-definitive one of just figure out by May or June, how are the kids coping? What are they doing at home? How's it
Yeah.
working? And neither the county nor the schools were interested in doing that. And the partnership didn't have.
So
the
that's your
staff
voice
support.
matters though, right, John?
Well, I don't care.
not a full Your Voice
I
Matter.
would
He
say
was
you
looking at some
ask
kind of
10
data.
questions.
I got you.
Right.
So,
I
but
mean-
what happened to the youth risk behavior for the last 2 years? Did Virginia drop it?
Yeah, as far as I know.
Oh, okay.
Yeah,
Oh my gosh, that's so funny. I've misunderstood. Every time Grace presents and says, we're almost there, I think she must have meant we're
Well,
almost
and
ready
she
to
was
roll
not-
out the new
no,
survey.
she's not sitting on anything. You know, she's still waiting for things to
Oh, so
wrap
she
up
must
at
have meant we're
school for
ready
her
to
to,
put out a survey, not we're
Yeah.
ready to
right.
give you numbers from what we had
Yes,
last time.
before.
I
So
got you.
it went out in the fall. So that's what
Oh.
what the
Yeah,
readying talk was.
the state one was the fall of
2019.
November of 19 and again in 21.
20.
Oh, that I have not seen.
And that's the one
2020.
that Grace is waiting for.
So
Yes.
Grace doesn't have anything from the 21.
She's got
No.
19 as the last data, I think.
Right.
So Virginia is still chunking those numbers. Is that it?
I don't know who they work through. I suspect it's a contractor. Yeah,
That's what, so I'm not completely mixed up. There was a survey.
yeah, and we're
Okay.
waiting for the data.
Okay.
And what I'm suggesting is if and when that data comes out, that's going to be a substantial part of some meeting.
Yeah.
It'll be
Yes.
half an
Yeah.
hour or more of the meeting
Right.
to go over whatever. But again, you don't want to jump at the data too quick in case you're looking at trends. You've got to go back and look at previous year's data.
Right.
And
Yeah.
the snapshot you can do immediately, but the trends you have to
Yeah.
go think about.
Yeah. I think the data group needs to kind of huddle to get to that point.
I'm not sure there's a data group, Lynn. Are you talking about a subgroup of the partnership?
There
Yes.
has been, there used
There
to be.
Yeah,
used
there
to
was.
be.
There used to be. Right.
It's
So
Right.
I was
But I
saying
don't
that
think
it,
we have one now. So you're saying let's do a huddle, but I think I did a call on one of the meetings and said, whoever's interested.
right.
And I've done a
Well,
few
it's gonna
one-on-one
be
phone
like
calls
the
and I
folks
haven't gotten
in this meeting.
volunteer.
You know, it's gonna be like the
Yes,
folks
yes,
in this meeting here.
Yes, yes.
So it could be a long
And we'll
P
see when we
D.
have
Yeah,
data, I think people
right.
get excited about it.
Right.
Yeah.
I
The
think you'll get
data
more
group
response then.
included people way outside of the partnership as
Right.
such. So it would have been somebody from the school data crew, and it was Lisa originally, and then somebody else since. And it would be the lady, Michael.
Yeah.
Karma, I forget her last name, from the county, and 2 or 3 external data people. I've got 2 or 3 people that I've met one meeting in the last year or 2 on Zoom. And their comments to the speakers were really on target and very data rich. So I was going to at least inquire of the host of those meetings if that person would like to show up, so that we have some external guidance on the quality, on the way of presentation, and to present data, you want a huge amount of skepticism.
That should work. What time?
Because without the translation, it can be very, very misleading.
Okay, do you want to do before or after?
All right, that sounds great. That's very exciting. Yes, I was worried it was supposed to
So
come from
just-
out of our membership, and I was like, I'm not hearing
Yeah.
people, who
Right.
are coming forward.
No,
Great, John.
Yeah.
We always had a couple of members. I was one and there was usually
Yeah,
one other member
okay.
maybe, but otherwise they're all external.
All right, see you tomorrow. Bye.
Great.
And
And we'll see, I don't think I mentioned when everybody was on, John and Judy, but we have 2 new people who have applied to be on the partnership.
Oh, good.
Yes,
So I'm
so the
gonna give
commission
each of them a
members, yeah.
call and see, what their level of interest is. And
Great.
so, we've got some new interests,
Yeah.
which is wonderful.
And it looks like at least
So-
one is, representation of diversity that we've been seeking, so that's wonderful.
Yeah, she mentioned, and the other one, her application was super short. So who
Yeah.
knows,
Right.
so we'll
Yeah.
find out. Yeah.
Uh-huh.
So, okay, great.
All right.
So why don't I draft up from my notes from tonight, a draft agenda, and I'll send it around to this group and catch whatever I missed. So,
Sounds good. Thank you, Megan.
and my
All right.
homework
All
is to find out from Dulce if somebody can speak about the budget.
Okay.
Okay, thank you.
I
Fine.
still need to,
Sorry, get
can
it.
I
Thank
get a
you.
copy, or can Sally send me a link to the last meeting?
I'm looking for it. I can't find it in my Zoom. I have the last PND meeting. I can't.
oh,
find it.
hold on. I sent it to our board, our school board member
Yeah, I
who
thought I sent it. I
blew
can't
us
find it.
off. Are we recording?
We are recorded.
Who didn't make it last time? No,
Yes,
I
she was
mean,
overcommitted.
she had a conflicting,
She was overcommitted.
she was overcommitted
There
and
you
she
go.
chose the other meeting. So I
Right.
felt personally insulted. Anyway, yes, I do.